first day of medical school, I remember our dean said that medical school is like drinking from a fire hydrant. And I think that residency is like drinking from Niagara Falls.
This was my first day of residency, so I walk in there into the ICU and get signed out. And the intern who was finishing up leaves for her next rotation. The minute she leaves, the patient codes. So I go to the code. And I go there and I'm looking at this patient, and so one of the nurses basically says, "Doctor, what do you want to do?" Looking at the monitor, heart rate's 40, blood pressure's going down. I'm like, what do you guys do normally? So, I mean, this is out there, and I was finally put in this situation. I was like, well, I have no clue what I'm going to do right now. So I asked the nurse, like, well, what would you do? Like, well, we'd give this. I was like, how much? Like, well, this much. I was like, that sounds good. Go ahead, go for it.
Residency is definitely challenging. I think what I find hardest is just keeping my energy up. There's a lot of things that you want to get done for your patients. There's a lot that you want to do.
As a person, I've matured a lot since I started residency, learning to sometimes not say stuff, you know. A lot of the times you are young, you say, I have to argue about this, and you learn just to hear what people have to say before giving a response, or sometimes not giving a response at all.
What I enjoy the most about residency is doing the work that I've been itching to do for 8 years now. Having direct contact with patients and having full responsibility for their care. The sense of awe is part of what gives it meaning and value.
One of the most rewarding things about residency is knowing that you're making a difference in people's lives, even if it's a small difference. Seeing your patients get better and make changes, positive changes in their lives.
I think up till now, residency training was a very clear-cut thing. I think with CIR we get some new movement into that, and also some other possibilities, and even the possibility maybe to change some things.
CIR is a guardian for what ought to be in healthcare, continually pushing the envelope for what should be.
CIR is a gateway to the whole other world of healthcare.
Maybe the most important role for CIR is helping us maximize the time that we have in the hospital and in the clinics to benefit our patients in a way that will most effectively change their health.
CIR is historic. I think to be a part of CIR when the work hours reforms went into effect was just very groundbreaking. It set a new standard, and really CIR was responsible for that. Every person, every lay person I've ever spoken to has said, you know, I don't want to be that patient that has that doctor who's on their 30th hour.
I actually had the great good fortune of being a resident at an incredibly exciting time when CIR was beginning to fight with a lot of other organizations for regulation of resident work hours, and I happened to be an intern at the time when the OSHA petition was filed. And so I got a call as an intern asking if I would be willing to come down to Washington and testify, not having really any idea what that meant. To stand up and talk about my own experience in a way that would then make a difference in terms of other people's lives was just huge. And I think I really at the time had no idea of the implications of that.
I think it's very important that unions such as CIR continue to focus on those issues, because who better knows the situations of the patients than the house staff, who spends more time with them than anybody else.
So I do medical student education now, and one of the things that's kind of amazing is to see how medical students really take for granted that they are not going to work more than 24 hours, and in fact in most cases even less than that, and that they can't even imagine a time when it was otherwise. And that was just not that long ago. And it's really, you know, it's about CIR. That's what made the difference.
I feel like for me personally, at my hospital, CIR has been a big support through negotiations, through everyday workings, call rooms, that kind of thing.
Just marching in the streets for what's right. And what's right is healthcare for all people. And the way that I got introduced to that aspect of healthcare was through CIR.
I guess my parents made me listen to Pete Seeger when I was younger, I think, you know. Yeah, they did, actually, you know, so maybe that's why. But, you know, it seemed like everyone should have a voice. Last year when I was a PGY1, just getting started with CIR, our school was thinking about shutting down the family practice program, which, you know, would have really taken, New Brunswick is a pretty underserved area, and a lot of people relied on those residents, those clinics to get their health care. And we were at a point where just for financial reasons, that would have been lost, and where would all these people have gone? And CIR actually, like, we talked to legislators, we stood in the rain and handed out flyers and kind of attacked from all different points of views, and the program was saved.
I had the pleasure of being there the night that the votes were counted, so I had a chance to be there when all the votes were in, and we heard that we won, and it was wonderful after all the effort that was put into it.
50 sounds like a great number to me, in the sense that there's still 50 years of experience, and hopefully 50, 100 more to help residents and the union and other hospitals.
Like anything else where there's a sense of heritage, you feel a responsibility to carry on the ideals and principles that form the mantle of the institution.
CIR is hope, it's a voice.
Perseverance is what I think CIR means to me.
It really is so much a part of who I am as a doctor and as a human being. It's just an amazing organization.
Okay.